Today, the personal statement workshop is co-hosted by the Office of Preprofessional Programs and Advising and the Writing Center. So we're so excited to have you join us tonight. We are going to talk through a few things, but this is also a really interactive session, and we're going to give you opportunities to be able to really do some brainstorming and get started on some ideas that you might have for your personal statement. And for those of you who are here in person, we're walking around, we're here as well. So if there's feedback or anything like that that you have a question about, please feel free to ask us. So we're here to help guide and facilitate that process. And for anyone online, if you have questions, please feel free to throw them in the chat. We will answer them in the chat, and then I will also repeat them out loud here so that everybody is getting the same information. For anyone in person, please just make sure that you check in at some point before you head out today. The check-in is right up here. And also feel free to grab any stickers, candy, and bookmarks that we have available. Okay, thank you all for joining me. I'm working two computers over here, so I will be clicking twice. So before we got started with today, there was a video that was in the handshake that you can still access. It's on our YouTube page, but it's a really great video to just watch prior to getting started with your personal statement or in the process of getting started with your personal statement, because it really highlights a lot of the essential questions that we are asked about the personal statement. When we have conversations with students about personal statement, a lot of times we're having conversations about like, how can I sound original when I feel like I've done very similar things that everyone else has done? How can I really convey how I feel about what I have done, and how can I not repeat my resume, right? So that video, I think, hits on a lot of those really good points there. But just for a quick recap of the video, personal statements are used to communicate your goals and motivation. It gives you an opportunity to really tell a story. It's not always your whole story. It's really hard to get your whole story. And if you're applying to medical school, that's about 5,300 characters. So it's hard to get your whole story there, but you can get a picture of a story about you. And that's really what the personal statement is for. So it also serves as an opportunity to persuade your reader that you are ready for the rigors identified in health professions, right? Like we all know that this is not an easy route to go down. It's not an easy profession. And you want to show that you have really thought about what it means to be in the profession based off of the experiences that you've had thus far. Are you committed to the time that it will take to accomplish your goal? Again, this is not an easy path, and it's also a really long one as well, right? So medical schools want to make sure that you're committed to this path and that you've really tried things out to make sure that you are committed and can be successful in accomplishing your goals. Have you developed the professional skills that are advantageous for this field, right? We talk a lot about competencies and the development of these professional and personal competencies. We talk a lot about self-reflection and growth. And medical schools, dental schools, health professions programs in general want to be able to see that from you. So the personal statement is one of your opportunities to be able to do that. You also want to demonstrate that you understand what you're getting into, right? Connecting your experiences. Um, I will say that when I talk with admissions professionals, one of the things that they talk about a lot is making sure that the student understands exactly what it is to the best of their extent that this person that you're going into school for, if you're looking to become a physician, that you know what they do, that you've seen a few physicians, that you've seen that there are things maybe outside of the patient care realm, right, that they're also responsible for. So they want to have you demonstrate a good understanding of what that looks like. So making those connections to your experiences. And have you thought about how you see yourself in the desired field? Have you thought about what skills, your thought process, your passions, what that's going to bring to the profession? So the personal statement gives you the opportunity to do that. The video also discuss personality profiles, so your characteristics, qualities, your attributes that you really hope to convey, and it gives some examples on how to be able to do that as well. I know that's often a part of the conversation that I have with students as well. Like, how do I show that I'm empathetic? I don't want to just say that I'm empathetic. How do I show that? And your personal statement gives you the opportunity to do that, and we'll talk about how. So yeah, connecting your experiences that you've had to those characteristics helps to contextualize it. And other tips that the video gives is that your personal statement does not have to contain only medical experiences. Sometimes that is I think, a large misconception that meaningful experiences that will help you along your journey have to all be within the medical field. What you're going into the profession is really a service-based field in medicine, right? And that's how you're going to serve people is through medicine. So having that understanding, you can start to demonstrate that through other experiences that you've had. Don't get too deep in the weeds on specific topics. Like that can sometimes definitely happen in an interview. You know, you meet somebody and you both geek out on the same thing, and that's great. You're making connections. But in the personal statement, you really want to be able to reach a wider target audience that's generally interested in why you're interested in medicine, right? So you don't want to go too much into the weeds of a topic because that's great. That might be a really great thing to study within medicine, but your reader, that's not what they really care about in medicine. And now they're reading an entire paper, just about a particular topic instead of you. You want to show, not just tell. So using actions and descriptions, depth over breadth. This is kind of, you don't want to fall into the trap of just repeating your resume. Like I've done all of these different things and kind of take people over time. You want to delve into a particular story, or a particular experience. It doesn't have to be, storytelling in the way that you might see in a book or a story in that way. But what you do want to happen with your personal statement is you want to bring your reader in with you. You want them there with you. You want them to leave with a better understanding of who you are as a result of what you've done. You want to avoid giving a lot of space to address academic or personal challenges. That really, you can use the impactful statement area to do that. And that's something that we can talk about in advising appointments. The impactful statement can really encompass a lot of different things or challenges that you might have had during your time. And that's something we can talk about if you're not sure exactly what to put in there. But you don't want your personal statement to focus around that one C you got in organic chem, right? When there's so much more to say about you. Not to say that any of you did, but if you did, it's okay. Not the end of the world. And you want to focus on yourself, show how you felt, how you thought in that moment, and how you reacted. So the personal statement is really an opportunity, for lack of a better way of putting it, to get personal. Okay, so becoming a distinctive applicant. We started using the word distinctive because a lot of the conversations that we have, students will ask us, how am I unique? How can I be unique? And to be honest with you, you all are not very unique from one another in terms of everything that you're doing, but what is unique is how you're doing it. So the distinctive part really comes in from how you go about doing it, what it meant to you, the value of those experiences to you personally, as opposed to the experience itself, right? Like in some way, shape, or fashion, you're all getting clinical experience, but what you're doing within that is distinctly different from one another, how you've gone about doing that. So we're going to put together this little Venn diagram for you where who you are is right there in the middle. So you are all of this encompasses who you are. So your clinical exposure in healthcare, your thinking, reasoning, discovery, and inquiry skills, your community service, your additional campus experiences, those metrics, your academics, and the standardized tests that you'll be taking. Most of you, the MCAT if you're applying to medical school. So it's not just about what you have done, right? It's like how you went about doing that and what that means as the total of who you are as an applicant, right? Not as a whole person. So in thinking about that, how do you bring this into who you are? So, in your personal statement, that's what you're really looking to reflect. You're looking to reflect a piece of who you are. So, your past personal experiences, your collegiate experiences, combined with your personal identity, values, and beliefs, right? We all have a lens through which we see the world that's shaped by our experiences. So, your personal identity, values, and beliefs and impactful experiences are a part of what makes you who you are, especially in your personal statement and your academic curiosities, right? Like, how have all of these blended together to get you to this point that you are ready to apply? Okay, so we like to think about it. It's kind of this thing that, like, feeds into each other. It's like it's definitely you're thinking about your and thinking about your why medicine, right? We talk about that a lot. And why are you getting into medicine? And it does delve a bit deeper. It can start off surface level. It can be that, like, I was interested in medicine because I always wanted to be a doctor, right? But now that you've had these experiences and you've been in spaces where you've seen medicine practice, you've been interacting with patients, what about the work that you're doing motivates you to keep doing it? To go down this path that's going to be a long and sometimes, well, it will definitely be challenging and sometimes difficult path, right? What is motivating you to do that? What about the patients that you've interacted with or what you've learned about them makes you want to keep getting up and going in every day? And I will say that I have sat in on some of the admissions decisions from medical schools, and that's something that is kind of standard across the board of what they're looking for in an applicant. They really want to see why you're motivated to do this. When you reach the point that this is sometimes hard to deal with, where you've hit a roadblock and something that you think should be easy to do is not easy to do, or you can't serve your patient in a certain way, it's hard to get up and then go back to the hospital, right? But they do it every day. So they want to see what's motivating you, what's keeping you going in your life. And you're not there yet where they are to have those experiences that are keeping you motivated, but you certainly had experiences thus far that's had you going back to those clinical experiences or engaging in community service or pursuing your academic curiosities, right? So identifying what motivates you is an important piece of your why medicine. Then you want to think about, and you can kind of do one or the other first, or any of these first, really. They kind of play into each other. But reviewing your activities and experiences helps you to get a better understanding of what your path has looked like. Sometimes we're doing a lot of things and we're doing them, and then we need to take a second, stop and look and be like, huh, why did I do this? Or what did I learn for this? Or why did I decide to do a leadership position in this particular student organization, right? There has to be some type of thought process that you are helping your reader to understand about your motivation and why you're doing this. You, in reflecting, this also, you want to reflect on the value of what has been added by the things that are in your portfolio, right? So, like, it's really great that you may have been in a research lab where you've published a paper, and fantastic. Congratulations, you're now a published author. But what was that experience like? Like, why is that valuable to publish, right? Not just to publish, but what did you learn in that process? The technical writing, the collaboration, the getting feedback on your writing. I will say that that's something that's particularly difficult for me. And I've been writing for a really, really long time. And I still dread giving someone my personal writing and for them to tear it apart. It feels personal. So it makes sense, right? Like, these are things that have mattered to you. So you want to reflect on that value that has been added by your experiences. Um, and then you can connect them, and we'll show you how to do this. We'll give you a little map that you can use if that formula works for you. Sometimes it's helpful to have a formula to kind of stick and plug things in that help you to come to these realizations. And we'll have that later on in this workshop as well. But you want to be able to connect these to the professional competencies for whatever school that you are applying to, whatever type of health professions program. So the double AMC is the one that most likely you'll be using if you're applying to medical school. If you're applying to dental, the competencies that from the double AMC will also apply. Essentially, they apply to a lot of programs within healthcare, but these are the ones that are specific that medical schools are definitely evaluating you on. And if you're interested in another type of program outside of medicine, I also encourage you to work with your pre-health advisor to identify the competencies that might be unique to your particular program. So, for instance, if you are interested in dental, in addition to things like your teamwork and your ability to show empathy and your communication. They also want to see that you have some manual dexterity, and that's not something that's required if you're applying the MD programs, but it is if you're applying the dental. So that's why I say you can work with your pre-health advisor to identify different skills that may apply to a particular program you're interested in. But you want to connect your experiences and the value that you've gained from those experiences to those competencies, right? So, for example, if you are a TA, you've probably worked with students and you've had to communicate ideas maybe a little bit differently than you may have received it initially, right? So you can connect that experience to speaking with students and having to communicate complex ideas to the competency of communication. So that kind of roadmap helps you to, if you're not sure exactly what you've developed within your experiences, that formula can help you to figure that out. And then you want to assess for themes. Sometimes themes appear in our life that we didn't even know existed. I will give you an example of something that has really appeared throughout my life that I didn't realize was a theme, but it absolutely is a theme. And that is my ability for organization and guidance. Even when I was in college, I had my friends, they would always come to me and ask me, like, oh, how should I put my schedule together? And what classes should I take? I was kind of doing the work of the advisor when I was an undergrad and had no idea I was going to be an advisor later on. So it's kind of like an interworking theme throughout my life that I didn't know existed. But looking back on the things that I've done, that has definitely popped up. So think about where you are in the process. You don't have to say it out loud or anything like that, but just think about where you are in thinking about your activities. Have you written out your activities? Have you added a description to them? Have you made a list of them? Are they kind of just something in your head right now? It's okay wherever you are, but acknowledge where you are and where you would like to go. And then you can create a plan from there about where you would like to be in assessing your activities. Okay, so in addition to the Writing Center, we also partner with Life Design Lab. And if you haven't been to Life Design Lab, just giving you a little bit of an idea about what they do there, they really motivate or help students to get curious. Sometimes you can walk into Life Design and have no idea what it is that you want to talk about, and they'll help you to brainstorm. You can go in and be like, I'm going to apply to medical school. I want to write my personal statement, but I don't really know like where to start. And they can help you with that process or where you are in that brainstorming. So they help you to think about what possibilities are out there for you. So when we talked about thinking about like what's going to be your contribution to the field, like have you thought about that? You might not have thought about that yet, and that's okay. But they can help you to think about where your interests are now and how that might play out in the future in your chosen career path. Also, they can help you to experience more if that's something that you also feel like you're looking at, like, oh man, I really would like an experience in this. I feel like that would really help me to think about this thing in a new light. They can also help you to think about that as well. What other experiences can contribute to that? And also help you to think about like crafting your story. And by that, I don't mean necessarily like your personal statement in full, but more of your personal narrative. Like, who are you and what does that mean at this point in your life? Okay, so the life design idea is kind of similar to like our little Venn diagram that we had going on here too, right? So thinking about these different spaces, like what you love, what your passion is, what your mission is, what the world needs, and they're really thinking about like how this all fits in together. So at Life Design, they can also help you to think about this. I think The idea and the brainstorming is helpful towards the personal statement process, but I actually think the work that Life Design does is also really great in thinking about like your overall application when you get to like the interview stage as well, because you're going to be asked constantly through this process. I know it sounds like we're always doing like self-reflect, 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 but it's so true because throughout this process and all the questions that you get, and the main part of your application is going to be that. That's what all of your writing is. So, in any way, shape, or form where you could get some support and help with it, I encourage you to take advantage. Okay, so just on how to connect with Life Design, they do have drop-in hours at the Imagine Center or virtually to 1 to 5 p.m. Monday to through Thursday. You could find the Zoom link online under Life Design Lab if you want to join them virtually. You can also meet with your Life Design educator. So Life Design has educators for specific majors. So you can go right on the Life Designer website, and they work with students across the board, so KSAS and Y students. So regardless of whether you are which school you're a part of, you can work with Life Design. And so they can help you to explore opportunities within and beyond medical school, and then also getting feedback on personal statements and other professional documents. But I really do encourage you, like in the brainstorming process, to utilize a few different services, and Life Design is one of them. Okay, I think you're up.
Hello, everybody. So here?
Yeah.
Okay. Hi, everybody. I'm Deirdre Vineyard. I'm the director of the Writing Center. I'm going to tell you a little bit about how we can support you through your personal statement process. How many of you have used the Writing Center in Gilman Hall thus far? Okay, great. Talking to some friends here. So if you haven't used the Writing Center, grab some of our literature. Our QR code will take you directly to our scheduling software. So let me tell you a little bit about how we interact with personal statements. What can the Writing Center do for you?
Okay, it's not. Okay, there we go.
There you go. Okay, so if you haven't been to the Writing Center, let me tell you a little bit about us. So we have trained peer tutors with personal statement experience. So there are different kinds of writing centers at different universities. Whoops, it's hard not to walk away.
Yes.
So we are a peer tutor center, and what that means is that all of our tutors are undergraduate or graduate students here at Hopkins. They know what you're going through. A lot of them are writing their own personal statements. And they've all received training. So they're trained, they go through a semester-long course so that they know how to respond to writing and how to help you in your process. In the Writing Center, we have 45-minute one-on-one sessions where you decide as the writer what you want to work on. So like I want to work on the introduction, or I want to see the flow, or I want to look at the argument, or I want to make this more about showing and less about telling. You can come in at any stage of the process. So that means you could come in with just the prompt, saying like, here's the prompt for my personal statement. I need to just brainstorm and figure out like what kinds of things I'm going to get on the page. And you can come in at the editing stage and anywhere in between. So you don't have to bring in a full draft at all. And this is for anything you bring in, because we can work with you on anything. And we give you personalized feedback on your writing. Okay, let's go to the next. Okay, great. So where are we? We're in Gilman Hall 230. That picture on the first slide was our Writing Center. It's also a study space. So you can come in there. It's one of the only 24/7 study spaces on campus. So you can come in and use that. We also have online appointments. We work with alumni. So if you decide to take a gap year, or if you are currently an alum, you can Zoom in on one of our online appointments. We are open Sunday through Thursday, 2 p.m. to 10 p.m. with 45-minute appointments on the hour. We're open now until May 1st, and then we're open for finals week for a few days. And then we have summer, May 26th to July 30th. Those are online only, and we do primarily secondaries then for med school. So there's a lot there. So as I said, the website, if you go onto our website, which is down here, you can make an appointment or you can just go to that QR code on the back of the bookmark. All right, let's go to the next. Okay, so I said that we all have experience with personal statements. So I went back and looked at our software. In the past year, writing centers have held 490 sessions on personal statements. A lot of those are repeat sessions. Students will come in several times, maybe working with the same tutor, maybe working with different tutors to get different eyes on it. So we have a lot of experience. I think it's the number one thing that we work on in the Writing Center. It's the number one most common thing we work on. But just so you know, if you haven't been to the Writing Center, we do work on anything you're working on. So it can be a lab report, it can be a research paper, anything you're working on, we can help you with. Okay. And how does a tutor help? Well, we can help you understand your purpose. So most of what we do is talking to you about what you're trying to communicate, what's the actual purpose of your writing, trying to refine that message. It's really important, as writers, because you've been writing a lot in college, right? And you've been writing since you were 6, that it's really important to get an outside reader's opinion to say, here, this is what I'm hearing. Is that what you're trying to communicate? Um, Structuring the narrative, right? So like this is different than a lab report, different than a research paper. How do I structure this in a way that's going to be catching and engaging for the reader? One of the things we know about personal statements is that the admissions committee is reading a lot of these, and you want to make yours pop. You want to make yours be memorable. What's that they remember something about you. So that's really important. So considering that audience perspective, clarifying your prose, make sure it's really clear, and then editing and proofreading. At that final stage, you're like, I've got what I want. Now just help me make sure that there's no little edits that need to be made. Okay, and then here's our tips from the Writing Center on getting a draft started. And I know you're going to work on this here. So I like to say, so for some people, it's about a free write, right? Make a mess, play in the mud. Just get in there and start jotting down ideas, writing, get something on there. Ignore sentence level concerns in a 0 or first draft. I like my students to think about a 0 draft. So like this isn't even a first draft. I'm just getting words out there. Make comments in your writing in brackets that you want to go back to later so that you don't stop yourself trying to make everything perfect the first time. And write to understand what you want to say. One of the kind of myths about writing is that you get an idea, you think about it, and then you put that idea on the paper. But what we know from research is that as you write, your ideas develop. So start writing and ideas come to you. So we like to say you write your way into understanding what you're trying to go for. And that's it. Any questions about the Writing Center? Okay, I'll make sure everybody gets a bookmark. Thank you so much.
Yeah, thank you. Okay, so before we jump into some brainstorming and free write sessions, we want to talk to you about how you can use our office during this process. So our partners are really, really great in helping us to get you to the point where you have a draft that you would like us to read. And we're really grateful to our partners because there's so many really talented, great students and alum from Hopkins who are going through this process. And it really is a team effort to be able to provide the support to all of you that we feel like you deserve through this process. So we're really grateful to our partners and we really hope that you utilize them. And we really do work well together. So when you get to the point where you've created this next to near final draft, and you're like, okay, I want some final feedback on this because I really want some help understanding or like what my reader from the perspective of the medical school might take away from what I am writing. So What we do with our personal statement feedback, we have two different ways of being able to do that, and I'll go through that process in just a second. But we really are here to help you to clarify your why. So you want to give your listener, reader, a sense of who you are throughout your statement. So some of the questions that we are looking to answer when we review your personal statement are: how do your values align with your interest in becoming a physician? What are things that you are good at or enjoy that you believe will be helpful to you in being an effective physician, and how? Answering that broader question of why medicine. That's what we're really looking to see, right? Like, this is my takeaway from reading this. Is this what you want it to convey to your reader? And then we can work through that together. And making sure that you're clear about the hopeful outcome, what your vision is for your future, and applying to medical school, dental school, whatever that might be. Okay, so you'll have two options with us, as you have had in the past. So if you've had any friends go through this process and they've talked about the personal statement, it hasn't changed. So the process will be the same. So our personal statement review will begin on April 1st, and our personal statement reviews end May 31st. So you have a full 2 months to be able to make an appointment with us, or get feedback from us in one of two ways. So you can schedule an appointment with us, or you can have an online review, which is a non-appointment. You'll submit your writing to us, and then we'll give you feedback in writing or voice notes or just digital. So we'll end up giving you feedback that way, but it won't be like a back and forth advising appointment. So either option is fine. It is up to you, as the person getting their personal statement reviewed, on which method you'd like to use. So, you should really be coming to us when you are close to a final draft, because we can only provide you with one review. So it's fantastic that you can go to the writing center as many times as you'd like, and you can go to the writing center after you meet with us if you would like to, after you receive feedback. But we can only provide one personal statement review, so that's why we really encourage you to be near completion with your personal statement. So you're going to submit one copy of that personal statement to the advisor who you made the appointment with on Handshake. You'll email that Word doc. Don't worry, this information will go out to everyone as well. So if you are completing the HPA, you'll definitely get the email from us, and we also send it out to our upper class listservs and alumni listservs as well, just so that you know. And this is also will be available in the EY27 committee page for anyone who's applying this upcoming cycle. So we ask that you send it no later than 2 business days, because this helps us to be able to read it beforehand. I will say that my better feedback comes when I'm able to read it and read it again. If it comes right before your appointment, that means that we're reviewing in your appointment, and that's absolutely fine. We can do that too, but I just don't think that it's as the feedback is as in depth as if you give us time to do it. So doing it 2 business days helps us to be able to be more effective in giving you feedback. And then in your advising appointment, we'll discuss your personal statement. For an online or non-appointment personal statement review, you're going to submit your personal statement draft through an online form that will be made available. And then you will just allow us 5 to 7 business days to be able to give you feedback. Katie, I see that there's a question.
Yes, in the chat, someone would like to know, would I be able to make another pre-prof appointment within the same month as the personal statement review appointment?
No, the 4 weeks still apply. So that's a really great question though. So thank you for asking. So the personal statement appointment will count as an advising appointment. So in that 4 weeks of separation that we ask that you give in appointments, that also applies to the personal statement review. Great question. Thank you for asking. Any other questions? Okay, if you are applying MD, PhD, we also have additional options for you, as you do have two additional essays that MD only applicants do not have. And that is your YMD PhD. So why are you pursuing both degrees? And then also your significant research experience. Because these are research-based essays, we do employ the help of our alumni who are in MD PhD programs to be able to work with you and give you feedback on these essays. And we're really thankful to our alum for adding an additional support system for our MD PhD candidates. So if you're an MD PhD person, you will submit both a personal statement for feedback, and then you also can get additional feedback on those two additional essays that you have. And also, we encourage you to use the Writing Center. You can absolutely use the Writing Center for those two additional essays. And that time period will be the same, April 1st through May 31st as our personal statement review. Okay, so just to give you a little bit like a visual on that timeline, you can use both LDL and the Writing Center for brainstorming. As was mentioned, you can go to the Writing Center with whatever you have at that point. So please do utilize them during the brainstorming process as well. When you move more into your working drafts, definitely you want to be in the Writing Center. And as you come closer to that final draft, move into your appointment with us in pre-prof. Okay, so let's take some time to get started now. We have a few prompts here, and we'll probably take about maybe 5 minutes or so on each to give you some opportunities for free write. And this is also an opportunity if you have a question or something like that from us, if you're here in person, you could just, give a raise of a hand and we can come by. But this, again, is really meant to be a brainstorming session. So we're not critiquing or giving anything like that on any of your ideas. But certainly if you're like, is this something that I should be thinking about writing down, or is this kind of like the right path for this question? We can certainly provide you with some guidance, but this is really meant to like be opportunity for some brain dumps. Okay. Okay, so first, let's explore your academic curiosities. So let's just take, actually, you know what? I feel like 5 minutes is actually a long period of time. So we'll actually just do 2 minutes. I feel like that's usually the free writing time, right? So in 2 minutes, just take some time to answer these questions. What subjects, topics have you found most interesting? Why did you choose your major? Are there other activities or experiences you have engaged in to expand your knowledge about topics or subjects that you enjoy? So let's take 2 minutes and do some free writing with this prompt. Oh, yes. I can come in. Also, if you haven't checked in and you're here in person, please, the check-in is right up here. And then there's also Canadian stickers with learns. Yeah. Great. Great. Yeah. The new realities. So writing person, I'd say like devil's advocate, but I asked to be there too, but she knows that she was also, because I know on some things. And that, I feel like probably not. Yeah. It's not the hot button religion.
That's something that is really that I would bring up. Yeah, I've done a lot of personal statements, haven't seen anything. Yeah, not specifically about Buddhism. Yeah, it has to be. Yeah, we're gonna translate to be, to,
Yes.
we got everything,
Yes.
particularly as you're one of the that, people just often start with like an anecdote. You're not starting like, yeah, and then you know, we need, so that we can, like, that obviously that's first. Yeah, that's great. You can apply out on one. So like, what values or what do you think you got? And then what do you take from that? That you might apply when you select that? I think that on my side, we usually be available for very awesome. I love that. Yeah, I'd love to see that. So like even if you have like an anecdotal, like, yeah, she's like, write a story, she's actually, you know, since like father. There's not, see, I mean, like, how to make that, like, the back is still a story, I saw this. Yeah. So, thank you, Davina. So, do you want to pose your question? I wasn't sure, like, I had like the writing perspective from the admissions. Sure. But my
Yeah, absolutely. Oh, yeah, we certainly have some talk about like that as part of their identity, and like, and a lot of times them encouraging like the community survey, so like that is so like with that. Yeah, yeah, because it's in all of it. Like their life, what the life. Right. Right. And how to go to it. No, I think it's more benefit when you use it in a way to keep it in like.
But also remembering Kim, and we participated with Kim DD about NSF grants, and it was like using it as I was in a marginalized position, and this is how I rose. That's what you don't really see, but this isn't like this is this is a way that informed my
right. And it also like adds to like your values. I saw you back there. I'm gonna thank you for there. No problem. You're welcome. I'm just gonna change these up here so that we can go over to the next topic.
Yeah, yeah, beautiful. Did you get everything? Okay, perfect.
Okay, great. So we're gonna just you can feel free to keep writing about any of the other questions, but for our free writing exercise, we're gonna move on to the second set of questions that is about your personal past personal experiences. So what are 1 to 2 specific significant personal experiences that sparked your curiosity in science or medicine? It can be something that has happened here. It can be something that happened before you got to Hopkins. You know, your life didn't start once you got to Hopkins. So I'm sure that maybe there's a handful of you, or maybe many of you, who have had experiences outside of here that have contributed to that. Do you have any experiences, hobbies, or interests before college that have contributed to your interest in healthcare medicine? If so, how? So let's just take a couple of minutes to like free write on that topic, and we'll come around again for anyone who has questions. I'm going to head over to you. And Katie, if you have questions in the chat when I come back up here, please feel free to shout them out and then I'll give an answer.
Absolutely.
Okay, great. Thank you.
Davina, I do have a question from chat.
Okay.
So Naga would like to know, a little unrelated, but for our personal statements, how would you recommend starting with like a hook or a meaningful experience? And I said that it's up to them. You can start in media res, you can start a meaningful experience. And I wanted to throw it to you to see what you said as well.
Yeah, you can absolutely. The question online was, would it be, how should I start my personal statement? Can I start it with like a hook or an experience? And I think that honestly, the way that you start is probably the last thing that you're really going to write in your personal statement. Your personal statement, like as you start to flush out ideas, will help you to decide how the beginning of your story actually starts. And you can absolutely start with either option. The goal of the personal statement is to be able to bring in your reader, but you don't want to like cloud your personal statement with words that are unnecessary, right? So it doesn't need to be like full of imagery. But it does help to say, to be able to describe what's going on. For instance, you don't need to say something like, overly like something like it was a gray, dreary, dark, dank, like using all of those descriptive words. You can say that, it was a dark windowless room, and that will do the same exact thing for your reader. It doesn't need to be like overly flowery with words. You only have a limited space. So you do have to pick and choose like how you want to approach this. But I do think that inevitably the beginning ends up being the last thing that you write. I hope that was helpful. Okay, so you can continue to write about these experiences as well, but we want to just make sure you see the other prompt. So your personal identities and impactful experiences, what aspects of your background, events, identities, etc., influence your values and beliefs? How are they connected to how you see yourself within medicine? This might be your upbringing, maybe your religion or your cultural values or the values that your parents instilled in you as a result of living in their house. Maybe you're very disciplined and you're very organized because that was a part of how you grew up. That's part of how I grew up. So I feel like that's where that comes from. So what aspects of your background influence your values and your beliefs? How have you handled adversity or setbacks? Can you show how you've demonstrated resilience and growth? So not every experience has to be one that goes your way, right? Like sometimes the most valuable lessons can come from things that really didn't go your way because it can show you how resilient you are. And that's an important piece. If I can really stress that in medicine, is to be able to talk about your resilience. That is going to be something that is present throughout your career in medicine as a student, as a physician, you are going to have to deal with different challenges and setbacks. And they want to see that you really thought about how to navigate those situations when they've been presented to you in the past.
Davina, I
Mhm.
have another question from chat.
Okay.
Eli would like to know, how far back in time is it common to go on a personal statement? I know most should focus on college experiences, but is it common to jump back to explain why medicine or a formative experience?
Great question. So the question was, how far back can you go or should you go in your personal statement when making that connection to your why medicine? So I think that you can go back as far as it is relevant. So some people, I've definitely read personal statements about people talking about doing growing up with their grandparents and like tinkering around with stuff or working with their hands in the garden. And that was a really huge piece of like why they chose to go into their major or why they like problem solving or why they're an engineer. So I think that it's okay to go back as far as it is relevant to your experience and why. So the personal statement, if you do have experiences that date back further than college, it is an opportunity to be able to highlight some of that, to be able to like show that distance travel, that journey, if you want to be able to provide like more context about your earlier life. But you shouldn't, the crux of what you're, or rather, that should not replace the things that you've done now. So that's relevant to like why you've gotten started, but we also want to know what have you done now that has now reinforced that essentially. Any other questions? Oh, yeah. Oh, yes.
Davina, I have a question in chat that I had started to answer, but you're here, so I'm going to catch you.
Okay, you can just read the question. Thank
Okay,
you.
the question is, how many different stories can there be in the personal statement? As there are many different aspects of medicine and life mentioned here, and many stories that show different attributes, competencies. And if there is more than one story, should they be connected closely in narrative?
Great, good question. So the question was about using multiple stories in your personal statement and how that might look. Is it okay to use multiple stories? Should you focus on one? So really when you're working out your personal story, I would say somewhere between 1 to 3 experiences is okay for the personal statement. Usually when you start to include a little bit more than 3, it can get like jumbled. Thanks. And what you're trying to convey. So I think that it's better to have an idea of maybe if you're thinking about different stories of how they're connected. So if they're all stories about you being able to show your empathy, then they're maybe all interconnected that way. If it's about your communication skills, let's say even if it was like you wanted to tell a story about working with a student, and then that's something that made you think about like when you were working with a patient. You want to have that interconnectedness essentially. So the next prompt, and we'll move through this a little bit quickly. The collegiate experiences. So what courses or experiences outside the classroom have significantly influenced your interest in healthcare, medicine, or dentistry? What role has research, community service, clinical experiences played in igniting and confirming your interest in healthcare, medicine, and dentistry? And for everyone who's attended tonight, we'll also just make a little PDF of these questions that we asked and give them to you so that you can use them as prompts for your writing if you would like to later. Just have it as a resource. So you can go ahead and take a look. Start writing about these questions, and I'm gonna just move a little bit more quickly. And that is what this slide is prompting me to do. Keep free writing. What or who has shaped your understanding of medicine, dentistry? How have you developed your sense of serving others? These are all just like prompt type of questions. You don't have to answer everything, but hopefully this will give you a sense of some of the things that you can start talking about in your personal statement. And again, we'll share these questions with you as a resource for you throughout your writing. So you want to be able to draw connections to answer your why. And so these are just the experience types quickly that you'll see in AMCAS. You can go to the double AMC and take a look at these experience types, and you'll get a sense of like what types of activities you'll be putting on your application. But these are essentially the experience types that AMCAS has. And we actually need to take off new for social justice and advocacy because now it's been on there for a few years. You can also, if you would like to, quickly just scan the QR code. This will take you to the double AMC competencies that we've been talking about, kind of making that connection to the competencies that they're looking to evaluate you. So how have the experiences that you've had helped you to develop these competencies over time? And again, these are all available on the Double AMC website. Okay, so this is that map that I was talking about in making this connection. So hopefully this map, experience mapping, will help you to be able to make those connections from your activities. So your experience, how you've demonstrated it, and then how has that been evidenced in your experiences, right? So maybe your theme is, I'm going to use communication again. So you've demonstrated that through presenting. Maybe you've presented a poster. You've done research. You've been to a conference. Maybe you've presented in class. But you've been working on your communication skills, right? And then maybe you've also demonstrated that by being a TA or a tutor. So you can use this map to be able to parse out those different pieces that we've been talking about tonight. In this formula, I think could be helpful because you can plug in some things here. So I want Will look to be a physician who does what for who, how, and because. And as a physician, I will look to blank to do what for who, how, and because. And filling in this formula can help to guide you and parsing out those different things within your experience. So hopefully this formula can help you, another like jumping off place for kind of your thought process on that piece where we're talking about like your vision, right, for who you would like to be or aspire to be within medicine. So one of the next to last things I'll leave you with is that on our YouTube page, and we'll also send this out along with the resources, we do have a video on utilizing the HPA to craft a distinctive narrative. So in that video, we go through the different pieces of what we ask you on the HPA and how you can use that to write your personal statement, your secondaries, how you can utilize it to really answer a lot of the questions that are going to be asked of you. We really hope that the HPA is going to help you with a lot of the work that you're going to have to do towards your application and help you to do it a little bit earlier. So that when you get to your application, you get to your personal statement and your secondaries, you have done a bit of writing already and you have some things that you can just pull from already, right? So we promise you nothing that we put in front of you is for naught. It really is all to help you because we know that these are the things that you're going to be doing down the line. So we want you to use everything that you get from us. Okay. So that is all. Any questions? I know that we've answered some throughout tonight. Yes.
That the letters of recommendation also have to be March 30th.
Good question. So the question online was about the HPA and the due dates for the letters of recommendation and the due date for the HPA. So the HPA itself is due March 30th. And yes, there's a section on there for your tentative letters of recommendation. We really want you to use that as like an exercise to know like who are you going to ask to write for you and why. But your actual letters of recommendation are not due until July 30th. So your letter writers have from now through July 30th to be able to get in their letters. I do recommend pushing your letter writers to submit in June. So that you're submitting your application in June, your application isn't waiting on their letters of recommendation. Once you complete that tentative letters of recommendation section in the HPA and you move on to the next section, it's going to open up a new portal for you labeled letters of recommendation and other materials. And that is where you're going to be able to put your finalized list of letter writers and also their contact information. And then you'll be able to send them an email right from there to upload their letter. And you'll be able to see when they have uploaded it. Any other questions? They can be about the HPA if you'd like, if you have questions about it. HPA drop-ins, we it this week and they will last throughout the month of March. HP drop-ins are group drop-ins. And what we found with the HPA, sometimes you have specific, very like personal questions that you would like an advisor to answer. And so you're more than welcome to still use advising appointments or regular drop-ins to be able to ask those questions because they're one-on-one. But the HPA drop-ins we do as a group because a lot of the questions that you have are overarching questions and usually on how to approach something or how to talk about something or does this competency maybe fit with this activity? It's not, it might be about your particular thing, but not so personal that can't be shared. And what we found is that a lot of people have the same questions. And so it's really nice for you to be able to hear from other people, hear the responses, and then also it invites more discussion among you all as well, because you're all going through this cycle, together. So we also want you guys to be able to come together as a community and have that support too. So if you come to HPA drop-ins, just know you're dropping in with everyone. Okay. Katie, if there's no more questions online, I think that we can go ahead and close out the Zoom.
All right, online friends, speak now or hold your peace. Right.
Thank you.
Oh, you're welcome. Bye.
Great. Thank you all for
Bye.
joining us.